Hi guys. Can you hear me? Good evening. Can you hear me? If you can hear me, please let's signify. Good evening, please. If you can hear me, I need a feedback. If you can hear me, please let's signify.
Good evening, alright. Yes, we can hear you.
Okay. How are we doing today?
Very well. The
Uh, okay, so good evening. My name is Taiwo Oluwakolumi, a student of food science and technology um from the School of Technology Lautech Ogbomosho. So I'm here today as a moderator, and as we all know, we have what we are doing since yesterday. We have how should I put it? We are on an online teaching on health and which teams Health for All, and it is called the Building Effective Advocacy in Multicultural Communities. So and as we all know, the what's it called was set for 3 days, and since today is day two, we'll kickstart with what we did yesterday, and we'll continue that again today. So and here we have two speakers that will be teaching us, how should I put this, lecturing us, making us know things that are pertaining to health as a youth. So here with me I have one of our speaker. Um, he is a student, a university student of Lagos, pursuing a BS, Bachelor in Science and Bachelor in Education in Human Kinetics and Health Education, with experience in front-end web development and data analytics. He has interned with Zuri 14G, training cohort and manage social media for organizations like Nuga and Queenswood. So here with me we have Mr. Showemimo Al Amin, who is also a volunteer with the New Children Initiatives, applying his media and design skills to communities projects. His knowledge spans HTML, CSS, JavaScript, and also SQL. He also complemented by um, the interest in public speaking and analytical thinking, passionately about personal growth and peer development. Mr. Amin actively seeks opportunity to expand his skills and makes a position impact in technologies and his community. So here with me, I would like to welcome Mr. Sowemimo Abdulamin on today's topic, which says building effective advocacy in multicultural communities. So Mr. Abdulamin, you're welcome, sir. If you are here, sir, please can you mute your mic? Can you unmute your mic, sir?
Oh, yes, good evening. Good evening,
Good evening,
or good
sir.
evening.
Good evening, sir.
Just for confirmation, can you hear me very clearly?
Yeah, I can.
Okay, okay, that's good then. Do I need to put on my camera?
Yes, shoot, sir.
Oh, okay. Good evening, or good evening to everyone listening in. Um,
Good evening,
my
sir.
name is Al Amin Shoemo, and um, final year student of education, University of Lagos. I believe I said every other thing. Our topic for today is building effective health health literacy in multicultural communities. I had a slide prepared. I don't know, and I'm having issues projecting from my system here. The network here is very bad, so I don't know if it's possible for the slide to be presented, or should I just keep talking?
Okay, sir. Let's. I'll check on if I can be able to display it here. If not, but I think you should continue. We will work on that.
Okay, okay, no problem, no problem. Um, I don't know if it's possible for, because from where I am, I can't see any chats, I can't see people interacting. But I don't know if it's possible for this to be an interactive session, or it's just one where, because there are points in the discussion where I would like to receive an audience, receive responses from the audience. So I don't know how that can be put into place. Is that going to be possible?
Hi, I mean, can you hear me? I'm sorry
Okay,
to cut you
I
short.
think I think somebody is here to do that.
Hi, can you hear me?
Okay.
Can
Yes, I
anyone hear
can.
me? All right. So we'll be
Yes.
dropping chats in the comment section. So you can check the comment section or the chat section.
Okay.
Yeah. All right.
Okay,
Thank
no
you.
problem. All right, no problem. Thank you. Once again, good evening, everybody, and I welcome you all. Before we dive into the big grammar, because I'm sure that a lot of people might, some people might be confused with the terminologies associated with the topic of the day. So I'm just going to try and break down each topic by definition, each word rather by definition, one by one. So first things first, let's look at what is health. A lot of people think about health and they think of it as just being your physiological state, which is your body state with the absence of illness. But health is much more than that. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, what is important to note here is that this definition emphasizes that health is more than just the absence of illnesses. It also includes the ability for someone to live a fulfilling and productive life. It will be difficult for an individual to live a fulfilling and productive life if their mental health is not put in check, if their social health is not, their social well-being is not put in check, if they don't relate well with people around them. It will be difficult for that person to live a fulfilling and productive life. Now, one thing I would like to touch on again is advocacy. Advocacy refers to simply the act of supporting or recommending or arguing, that's the best word, for a particular cause. In essence, it means speaking up or taking action on behalf of yourself or behalf of another person or on behalf of a group to promote their interests and to promote their rights. Now, what is health advocacy? Health advocacy is the act of promoting and protecting the health of individuals and communities. It involves raising awareness, influencing policies, and advocating for equitable access to healthcare resources. So, what that means is that as an health advocate, you are taking an active role in promoting and supporting health related interests, either for yourself or for people in your community or for people that don't have access to equitable healthcare. Now, what is health equity? Health equity is the fair and just distribution of health outcomes and access across all segments of the population. What this simply means is that everybody in a particular population, regardless of their ethnicity, regardless of their socio-economic status, whether they are rich or poor, regardless of their gender, regardless of any other factors, they have the opportunity to achieve their optimal health potential. Health equity is more than just the absence of health disparities. It requires addressing the root causes of health disparities, such as the social factors, the economic factors, and the environmental factors. Now, moving on, please, next slide, please. So now that we've explained what all these are, let's look at multicultural communities. A lot of people agree with me that the most prominent example of a multicultural community in Nigeria is Lagos. Multicultural communities are communities where people from various cultural backgrounds coexist and interact. They can be formed through immigration, migration, or historical circumstance, and they are characterized by a diverse range of languages, of religions, of traditions, and of customs. The next slide, please. So, this is where I was requesting to see if it's possible to get responses from the audience. Because before I move on, I would like for people in the audience to drop one health challenge or one health problem they've noticed in their immediate community. It doesn't have to be something big, just the simplest thing you notice that in your community. Just for example purpose, I'll give an example. Um, in my community where I grew up, the main problem which I noticed during my days in secondary school and my days after is substance abuse. Substance abuse is, and I believe that a lot of communities too share this problem because it is a contemporary problem and it is one that is faced in many communities around Nigeria and around the world. Substance abuse has gotten to a stage where children, yes, children under the age of 18 abuse substances that are clearly, clearly and quite obviously being a detriment to their health. And this is bad because some of them are doing it out of ignorance, some of them are doing it out of peer pressure, some of them are doing it out of um, depression. There are so many factors that contribute to it. So I'd just like for people to drop one health challenge or two that they've observed in their immediate community. While everyone does that, please next slide, please, because of time, so that move to the next one. So, a lot of people would want to ask now, why do we need to advocate for health in multicultural communities like Lagos? Um, what is the vital reason for it? And I would suggest that it addresses the unique health needs of diverse population. That's number one. And the second thing that is that it promotes health equity and social justice. And the third thing is that it ensures cultural competent healthcare delivery. What this simply means is that in a community where there are people of different cultures, people of different backgrounds, people of different socioeconomic status, it is very possible and highly likely that some people would suffer from um, suffer from a fair and quality access to healthcare, and most of the time we suffer from it due to these factors that I just explained. We will explain them further during the course of the session. What that means is that let's say for example in Lagos, there are communities in Lagos where there's a particular cultural group that is more prominent in that community, and for some reason or the other, they don't have access to equal healthcare as people in other communities have access to. So just next slide, please. Now, how important is health equity and health advocacy for multicultural communities? How important are they? The first thing is that they help to address health disparities because, like I said, multicultural communities often experience health disparities, and it's due to different factors. It could be their socioeconomic status, it could be their language, maybe they speak a different language, it could be cultural misunderstanding, but advocacy can help address these disparities by ensuring that there's equal access to healthcare services and they are also promoting cultural sensitive care. Another importance is that it helps to improve health outcomes. By addressing health disparities in multicultural communities, health equity and advocacy can lead to improved health outcomes for all individuals and communities. It can also build trust because advocacy can help build trust between healthcare providers and the patients from diverse communities. And it leads to a better situation of communication and collaboration among all parties. Health equity also, and health equity and advocacy also helps to empower marginalized communities. Marginalized communities are communities that are deprived of certain blemishes of the community, like socioeconomic status, um, health, equal access to healthcare, and they can advocating for health in this type of communities can you can help participate in the decision making processes related to their health, ensuring that their voices are heard and that their needs are met. So I've been mentioning health disparities since, and I know, understand that some people might be confused as to what health disparities mean. Health disparities refer to the unequal distribution of health outcomes and access to healthcare services across different groups of people. Now, these disparities are often influenced by social factors, factors, environmental factors, or genetic factors. So, some examples of marginalized communities, like I explained just now, an example is ethnic minorities. I mean, the place where in a place where a community where a particular ethnic group is more prominent than the other, the minor group tends to suffer from being marginalized in that community. Another example is the most common one is people living in poverty. Another example is people with disabilities. People with disabilities are often subjected to less opportunity for health outcomes. And another example that is most often overlooked is people who are incarcerated or formerly incarcerated. So that means the people who are in prison currently or people who were once in prison who served a jail time. Now, these marginalized communities often experience significant health disparities compared to more privileged groups. Now, I've been mentioning social factors, environmental factors, and economic factors. But what are these factors? You can move to. I've been progressing in the slide. You can move to you can move a couple of slides forward. So, factors affecting health disparities. What are these factors? So, the first thing we have is social factors. When we say social factors, the most prominent one is poverty. The most prominent one is poverty, and another one is discrimination, and then stigma. These are very common factors in this society that we live in today and the time that we live in today. Another example is envir-
I
environmental
am.
factors.
I'm
Yes,
sorry to. Yeah, I'm sorry to cut you. Please, can you see the comment section?
no, I cannot. That's what I was asking earlier.
Oh, okay, okay. Give me a few minutes. You can go on, please.
Okay, I think I can see something from Fatia Aziz, where she said illegal refuse dumping. I believe she was regarding to the
Okay.
health
Yes. Yes.
challenge. Yes, yes.
Yes. Thank
Fatia,
you.
thank you very much. Yes, thank you very much. You're actually very right. Illegal refuse dumping is something that is very prominent in the nation that we live in today. And actually, I have a personal story with this, but let me not dive into a tangent. But thank you very much for your response, Fatia. Another example is environmental factors. And out of the environmental factors, we have pollution, which is what Fatia just mentioned. A lot of people pollute the environment, and when they do this, they are putting the people in their communities at risk. They are putting their own health at risk because when you don't properly take care of the environment, the only person that will suffer from it is you. Another example is unsafe housing, lack of green space, and then we have economic factors. And when we say economic factors, we have income inequality, we have unemployment, and we have debt. Now, let's move on to specific health disparities that marginalized communities often face. Now, what are the specific health disparities that these communities often face? Next slide, please, so that the people on the image can follow. The first one is higher rate of chronic diseases. These marginalized communities often experience higher rate of conditions such as heart disease, diabetes, stroke, and cancer. Another prominent health disparity that they suffer from is maternal and child health disparities. You see, the women in these marginalized communities, they have a very high rate of maternal mortality and infant mortality. And mortality is probably just the end game. The journey to that, a lot of children in these marginalized communities of, very often suffer from diseases like malnutrition, nutritional diseases in general. They often suffer from a lot of communicable diseases due to the lack of proper environmental healthcare system available to them. Another prominent one in this world that we live in today is mental health disparities. You see, the access to mental health services is often limited because most of the times, most of these people in organized communities don't even believe that their mental health is something that they should take care of. And most of the time, it leads to a higher rate of mental disorders. Now, when they say mental health disorders, it's not just, it doesn't necessarily mean that when someone has lost complete sanity. No. There are other types of mental health diseases that people often suffer from. Another one is substance abuse disparities. Now, substance abuse is very, very prevalent in marginalized communities due to factors such as poverty, stress, and limited opportunities. Now, the next thing we're going to talk about today is cultural competence in healthcare. Cultural competence in healthcare. Now, what is cultural competence? Cultural competence in healthcare refers to the ability of healthcare providers to interact effectively with patients from different cultural backgrounds. It has to do with understanding and respecting your patient's cultural beliefs, their values, and their behaviors. One of the challenges faced due to cultural competence in the society we live in today, the number one thing is lack of awareness. Most of the healthcare providers in our country today, most of them are unaware of the cultural differences, or most of them hold stereotypes. Most of them hold stereotypes that negatively impact patient-provider interaction. Another one is language barriers. Communication difficulties can arise when the healthcare providers and patients do not share a common language. Another one is cultural beliefs and practices. You see, the differences in cultural beliefs and practices often lead to misunderstanding and mistrust between patients and healthcare providers. The major problem we face in our country today is stereotyping. Healthcare providers often stereotype patients based on their cultural background, based on their ethnicity, and this often leads to biased treatment. And another one is ethnocentrism. The belief that one's culture is superior to others. Very, very, it has a very serious negative effect on communication and healthcare. So I want everyone listening to consider their own healthcare experiences. Next slide, please. I want you to mention a place or a situation where a cultural misunderstanding has affected the healthcare quality provided to you. And I want you to drop it in the chat if possible. Next slide, please. Next slide, please. Okay. Moving on. Um, though there are challenges, there are also opportunities. In a world where cultural competence in healthcare does not exist, or cultural competence in healthcare, the challenges in cultural competence in healthcare does not exist. Challenges are not faced. What are the opportunities that cultural competence can present rather? One of the opportunities is that it improves the patient-provider relationship. You see, when you're competent culturally with the people you're providing healthcare to, you understand their beliefs, you understand their pain points. It will assist the healthcare providers to provide better care and more effective care and lead to a better rapport between patients and providers. Another one is enhanced health outcomes. Understanding and respecting patients' cultural beliefs can lead to better health outcomes. Another one is professional growth. Developing cultural competence, it can reward a person's professional experience. It can reward the professional experience for the healthcare providers, and it can also reward the customer experience for the patient in need. But how can we improve cultural competence? This is where health advocacy comes in. One of the ways we can, the first way we can improve cultural competence is by providing cultural competency training, which means we advocate for healthcare providers to understand and educate themselves about the cultural differences and how to interact effectively with patients from diverse backgrounds. Another one is to hire culturally diverse staff because a diverse workforce can help to create a more inclusive environment. The most important one is to seek input from patients. You should ask your patients about their cultural preferences and the needs that they need to be assessed to. The main point of today is advocating for health for a more effective community. So how can we effectively advocate for health? Advocacy is a powerful tool for promoting health and well-being, and there are different strategies to go about this. One of the most effective strategies is community-centered approaches to health advocacy. When we say community-centered, what does it mean? It means community engagement. Involve your community members in advocacy. You see, it is very difficult for one person alone to make change, but it is very possible for one person alone to drive other people to make change. So you should involve your community members in the advocacy process to ensure that their needs and perspectives are represented. Another thing is grassroots organizing. You can build grassroots movements to mobilize community members and raise awareness about several health issues. Another one is community health assessment. Conduct assessments to identify specific health needs and priorities within the community. You see, this is why I asked the question I asked first about people looking in their community and um, checking out the health challenges that they face. So, for the example that was raised on illegal refuse dumping, it's something that it's probably something that you see in your community, and it's probably something that's a pain point for you, and perhaps that conflicted onto how to bring about a change. An effective strategy you can do is to involve your community members. You can speak with people in your community about how their perspectives and needs are being negatively affected with the way they treat their environment. Another strategy to take with is building partnerships with healthcare providers, with healthcare organizations, and healthcare policymakers. Collaborating with healthcare providers and organizations to develop and implement advocacy strategies is a very crucial tool. Another thing is coalitions. You can form coalitions with healthcare organizations. There are different NGOs, there are different, not even NGOs, governmental organizations that will be willing to help. And they can also help you amplify your voice to the community to increase the advocacy effort. Another one, which is very, very important, is networking. To build relationships with key stakeholders to increase visibility and influence in the community. You can build networks with the stakeholders in your community so they can help you influence people better. You can also develop an effective communication strategy. You see, most of these communities, sometimes you have to tailor the message you're trying to pass in such a way that resonates with the audience, considering their factors such as age, considering the factors such as culture, and also considering the factors such as the socio-economic status of that community. You could also utilize multiple communication channels. You could use print media, you could use public events, you could also use social media if it is a more prominent society. Another thing you could do is cultural sensitivity. Excuse me, please. Sorry. You should ensure that the communication efforts you are taking with they are culturally sensitive and culturally respectful. Because naturally, a lot of people are very defensive when it comes to their culture. Another additional strategy that I personally advocate for is the use of data. You see, you can use data to support advocacy efforts and demonstrate the need of change. What this means is, with data, you can understand and predict and critically analyze the main pain points in the community and the effective way to help improve this community. Another thing is testimony. You could collect personal stories from the community members to illustrate the impact of these health issues that they are facing. Another strategy is lobbying. You could advocate for policy changes at the local or at the state or at the federal level. Now, a very I don't know the particular word to use here, but let's just say it's very prominent. Is media outreach. You see, the engagement with media outlets to raise awareness and generate public support can go a very long way, very quickly, when it comes to advocating for health in the community. Now, in marginalized communities, the most prominent method of advocacy is public education. You see, providing information and education to the community about the health issues that they face and different strategies they can take to prevent themselves from facing this health issue is very important. Now, I would like to ask everyone here again, in your community, in your personal community, what communication channel do you think would be most effective in reaching your community? Could it be social media? Could it be print media? Could it be public health education? Or would it be an even innovative um, platform for communicating health information to the community? Now, moving on to the next slide, please. So let's look at success stories and case studies. Now, a prominent initiative in Nigeria is the AIDS Prevention Initiative in Nigeria. How many of us here have heard of AIDS Prevention Initiative in Nigeria, APIN? If you've heard of it before, please just drop a comment on the chat box. You see, this is a non-governmental organization in Nigeria focused on combating HIV and AIDS. At the time of their inception, HIV and AIDS was a very, very serious, prominent issue in Nigeria. And they provided prevention services such as condom distribution, VCT, care and support for people living with HIV and AIDS, and advocated for policies that support the prevention and care for HIV and AIDS in Nigeria. Another example is the New Child Initiative, an organization that I've been volunteering with for the past 5 years. You see, the New Child Initiative is a Nigerian NGO. They are dedicated to improving the lives of vulnerable children and breastfeeding mothers. You see, they provide essential healthcare services such as nutritious food, educational opportunities, and protection from abuse and neglect. Now, you may ask yourself, what's the importance of sharing these stories with you? One of a major importance of sharing these organizations with you is, like I said, a lone soldier, it's very difficult for a lone soldier to bring about change in the community. But you see, when you involve the community in advocating for health, it brings about a faster and more effective result. You see, volunteering with organizations like this can help build a community where you have an initiative where a lot of people are committed to one goal, which is improving the health, the health situation and health outcomes of individuals in the community. Another example is the anti-suicide and depression squad. Now, this is a very prominent and a very important non-governmental organization because, as we all know, mental health services are very, very limited in Nigeria. Now, the anti-suicide and depression squad is a non-profit mental health organization that helps safeguard people's mental health. They help by enlightening, they help by increasing the awareness of mental health in Nigeria with a main focus on depression and suicide. Another prominent example is I Choose Life Nigeria. I Choose Life Nigeria is a very prominent non-governmental organization, although they are based in Abuja, but their work goes around the constant advocacy for prevention of substance abuse, especially in young children. So why is it important to know about this organization? You see, this initiative helps in the ability to improve public health and well-being in Nigeria. You see, they've contributed to reducing disease burden, they've contributed to improving the access to healthcare, promoting health equity, and building community resilience. A lot of these organizations also help driving about policy change, like the APIN, AIDS Prevention Initiative in Nigeria. So how can we empower community voices? How can we build health literacy? How can we improve and advocate for health in our community? An example is for community-based education. You see, developing and implementing health education programs tailored to the specific needs and cultural context rather, of communities. Another thing is accessible information, ensuring that the health information is available in multiple languages and multiple formats. It could be print, it could be audio, it could be visual, it could be social media, but ensuring that there is equal access to this information for all individuals in the community is very important. Another thing is health literacy assessment. You see, to identify the gaps in health literacy and tailor these education programs accordingly, you need to first of all assess the health literacy of this community. And the best way to do this is to partner with schools, to partner with community organizations, to help integrate health education into this community. So how can we amplify underrepresented voices in our community? How can we amplify their voices? How can we make their voices heard? The first thing is through community engagement. You see, you can involve community members in the development and implementation of health policies and programs. You could also provide training to community members on advocacy skills, including how to communicate effectively with stakeholders and decision makers. You see, by empowering these communities, voices, and building health literacy, together we can create a more equitable and effective healthcare system that meets the needs of all individuals. So I want to ask this last question while I go to the chat box. If you could design a health education program for your own community, what key features would you like to include to make it culturally relevant and to make it engaging? Now, remember, to make it culturally relevant, you have to understand the pain points and the cultural sensitivity of that particular community. So take these factors and think about how you can develop a health education program possibly for your community. Now, going through the chat box, um, illegal burning of refuse. Yes, that's from Kolade Rachel. Yes, that's a very prominent problem we face in most communities these days. The illegal burning of refugees, and it's usually down to a lot of factors. You see, most of these things are very complicated. But if you want to drive about change, it is very easy. It is very easy when you have a community of support, have a community of like-minded individuals that are also they feel the pain and the need for this type of things to change in the community. And someone else mentioned that mental health services are actually very limited. Yes, that is very true. Because um, most of the time, Nigeria is still a very cultural society, and most of the cultures and ethnicities in Nigeria do not believe in the need to advocate for mental health. Most of them ignore the importance of mental health and how it can help shape an individual. and how key and necessary it is. Someone else called Adi said, okay, mention social media. Yes, sorry. Social media can be a tool to pass across health information, especially when you're living in a more prominent society. A society where most of the members of that society have access to social media. Thank you very much for your comments. I really appreciate. An example is the cultural stereotype in healthcare and pretending they have people. They tend to be perfect. As much as I would like to maintain a cultural neutral point here, I I do believe that you have a point, but not necessarily. I'm not going to use the example that's today just to maintain neutrality. But yes, this is an example of what I was talking about. You see, most of the time, especially in the country in Africa as a whole, not even Nigeria, we usually hold cultural stereotypes against population of the same community, against population of the same nationality, simply because of the differences in ethnicity and culture and cultural differences. And this is not right at all. So, um, just to conclude the session for today, the first thing to recap, a key takeaway is that health advocacy is crucial for addressing these disparities in multicultural communities, such as the ones we live in. And effective strategies involving community-centered approaches and strong partnerships are usually very effective for driving about change. You see, the success stories show the power of culturally tailored interventions, and empowering community voices is essential for a sustainable change in our communities. I'd like to thank everyone that has been listening, everyone that has been dropping their comments on the comment box, on the chat box. I really appreciate. And I would also open the floor for questions. If there are any questions, if there's anybody that has a question they would like to ask, you can easily type it on the chat box. Thank you all very much. I really appreciate it.
So thank you very much, sir. Thank you very much. If we have any question, please let's drop it on the comment section. After the two sessions, we can now ask our questions. Can you hear me? Can you hear me? Please, if you can hear me, please reply on the comment section that you can hear me.
Yes, we can hear
If
you
you have
alright.
any question, please drop it on your comment section because very soon we'll be having our second speaker on board. So if you have questions, please drop it and everything will be asked immediately after the second speaker. So if you can hear me, just signify and put your questions there. Thank you. So to the next speaker that we are having today, her name is Mrs. Rispa Oching. She's a Kenya health technologist practitioner, and I don't know if she's here already. Is she here already? Mrs. Rispa, can you hear me? Okay, send the exam that she comes on board. Please let's drop our questions. Maybe we should continue with that for now. Our questions, please. I can't see anyone question here. Please ask your questions because I know we've learned a lot from what has been said from Mr. Abraham. So please ask your questions. Ask your questions. Sending the time that the second speaker will come on board. Please let's drop our questions on the comment section. If it is something you cannot, just drop. I'll read it out. Please, just drop your questions. Okay, so also we can drop what we learned so far, like from what the first speaker has spoken about. We can drop what we learned so far on um
building effective advocacy in multicultural communities, talking about health because that is what he specialized in. He's talking about the F was report on building the effective advocacy in multicultural communities. So I know we've learned one or two, even three. So it's something that we can, even if you have a new idea as to what you have said, to buttress his point, you can as well drop it in the comment section. Or better, if you still want more elaborate, like to be enlightened, please drop it in the comment section by asking your questions so that we can do justice to everything that has been said today. So please, we will be waiting for your questions. Please drop your questions. Okay, since we don't have question yet, is Mrs. Ripper, is she here?
Hi, can you hear me?
Yes, I can.
Yeah, so the second speaker is not available for today, but by tomorrow she should be available. So we'll only work with Alami for today.
Oh, okay.
So
So
if we have questions,
please,
we
if you
can. So
have
in the next
questions,
five
please
minutes, we'll be
drop.
ending the session. There are no questions.
Okay. So please, if you have questions, because I know we want more like to elaborate, like enlighten you more. I know there are still more to learn pertaining to the topic of today, to the theme of today. So please ask your questions. Please ask your questions. Don't be shy to ask your questions. Don't that is why you can drop them and I will act on your behalf. So please drop your in the comment section the question or do we all understand what has been said so far? Do we all get what has been said so far? I'm still expecting our questions. I can't see any questions. That means we are all saying we understood or we understand everything that has been said. And Mr. Alamid has done justice to today's theme, to today's topic, because that is what it's insinuating that we don't have questions. We get everything that has been said. We understood it so well. So, Sister Shewa, are you on board? Are we there? Okay, so since there is no questions for now, I believe by tomorrow, which is the day three of the what's it called, the empowering of youth, teaching us on health and all that things. So I would love for us to like write our questions. I know by now maybe we are still trying to like stick it in, like digest it. So by tomorrow, please let's have our questions ready to ask so that they can answer. And it is that they are not online or they are not in the stream or the space with us. It's something that we can send to them and you will get your questions, your answers to the question you have back. So in view of that, since we don't have any questions, I would love to end the meeting now. And I would love to appreciate those that joined. I would love to encourage us to join for tomorrow. And I also want to encourage us to get our mind ready for what is set to happen tomorrow, what is the classes, the lecturing. So I want us to get our minds ready. So thank you for joining today. We really appreciate you giving your time, your little time to join this space, and we pray and bless that the good Lord bless you. And we'll be expecting you same time in same space tomorrow. Thank you and have a blessed day and a wonderful night rest. Thank you. Oh, okay, okay. Is Mr. Amin still here? Hello, sir. Okay. Somebody asked a question. He said, or she said, what other ways can we impact and empower our communities if there are limited resources available? If you are here, please can you come on board to explain better? He asked, he said, what other ways can we impact and empower our communities if there are limited resources available? Mr. Alamin,
It's more clear. Hello? I think Alamin has left the call. He's probably having network issue or something. Can you hear me, or
oh, yeah, I can hear you.
yeah? So he left the call. I think he's probably having network issue or something. So might have to move this meeting to tomorrow. Thank you
Oh,
everyone for
okay, ma.
joining. All right.
Thank you very much. Thank you very much, ma. Take care. Bye.